Welcome to the Montefiore Center for Joint Replacement Surgery. My name is Yolanda Dandridge and I am the Director of Patient Experience. I plan to meet you on the day of surgery to welcome you, provide an introduction to the joint replacement program, and I will follow you throughout your hospital stay. I commit to making sure that you feel at home, surrounded by people who care about you. The Montefiore Center for Joint Replacement Surgery integrates the patient and family-centered care model into our patients' delivery of care. Because we know that every patient has individual needs, we create partnerships between our patients, their families, and the healthcare team in the decision-making process. The Montefiore Center for Joint Replacement Surgery is one of the busiest joint replacement centers in New York City. Our patient satisfaction scores are outstanding, and we rank in the top tier across the nation. The Joint Commission of Hospitals awarded the Montefiore Center for Joint Replacement Surgery advanced certification for hip and knee replacement. We are the first and only hospital in the Bronx and Westchester counties awarded this certification. Also, U.S. News and World Report recognize us as high-performing hospitals in orthopedic care. We know that you could have chosen any other hospital, but you know where to come for the best joint replacement surgery, the Montefiore Center for Joint Replacement Surgery. Thank you for choosing Montefiore, and I look forward to seeing you on the day of surgery.
Hello. Welcome to the Montefiore Center for Joint Replacement Surgery. My name is Savino Stallone. I'm a health educator in orthopedics. The goal of this presentation is to provide you with information regarding what to expect before, during, and after your hip or knee replacement surgery. Throughout this presentation, we're going to meet practitioners from various specialties. One of the most important parts of the surgical process is identifying somebody who we call a care coach. A care coach is a family member, friend, or significant other that you can trust to be with you throughout the operative journey. Our goals include ensuring that you improve your quality of life, increase your range of motion, decrease your pain, and return to the highest level of function as possible. At the Montefiore Center for Joint Replacement Surgery, we are a patient and family-centered care organization. Our goals include providing a supportive environment and ensuring that we always show respect for you and your family. I would like to talk to you about the anatomy of a hip and a knee. The white surface coating the end of the hip and the knee bone is called cartilage. Cartilage is a tissue that cushions the bones and keeps joints moving easily and pain-free. When cartilage wears away, the bones in the joints are not cushioned from movement or impact. When you move, when you get up from a chair, or when you go up and down stairs, those bones rub against one another and decrease our range of motion and cause pain. The goal of the hip or knee replacement is to replace the worn-out cartilage with smooth surfaces, to rebuild the hip or knee joint, and to restore your range of motion and decrease pain. Before you undergo your joint replacement surgery, you want to make sure that you are both mentally and physically ready to undergo the surgery. As we'll be talking about in a bit, there is a lot of physical therapy associated with surgery, and we want to make sure that you are ready. Before surgery, it is important to let your orthopedic surgeon know if you have any of the following medical conditions, or if any of the following applies to you: sleep apnea, alcohol or illicit drug use, high body weight, heart disease or history of blood clots, or any other complex medical or mental health issues. Our medical team will provide us with the appropriate clearances prior to surgery, as your health and safety is our highest priority. You also want to let your orthopedic surgeon and medical team know if you smoke cigarettes. Smoking decreases blood flow. Smokers are at an increased risk of healing complications and suboptimal outcomes. If you have not already done so, please consider significantly reducing the number of cigarettes that you smoke, or completely eliminating it from your lifestyle altogether. Prior to your surgery, you will have appointments that you will need to keep. One of the appointments is for preoperative blood work and an EKG. Following that, an internal medicine specialist will contact you via telemedicine or an in-person visit. These medical doctors will go over your blood work, your EKG results, and determine that you are medically optimized to undergo your hip or knee replacement. You may also receive a phone call from a social worker, financial representative, and a home care agency representative. Prior to your surgery, you will also get a phone call from either the orthopedic surgeon's office or a hospital representative, informing you of the time to arrive at the hospital on the day of your procedure. Medications may be prescribed for you that you will begin taking 2 days prior to your surgery. Your surgical team will give you complete instructions on how to take these medications. The goal of these medications is to help with your pain. The day before surgery is a very important time and you have a key role to play. This package contains 6 antibacterial wipes. Everyone who is having surgery will receive these wipes from the orthopedic surgeon's office after they elect to proceed with surgery. The goal of these wipes is to decrease the risk of infection after surgery, and they will be used the night before your procedure at home. Instructions on how to use these wipes are included in your preoperative education booklet. You will also be given a set of wipes to use in the hospital on the morning of your surgery. You may not eat or drink after midnight the night before your surgery or the morning of your surgery. The only exception to that rule is if our medical team has instructed you to take any medications the morning of surgery. If that is the case, you can take that medication on the morning of your surgery, but only with a tiny sip of water. A lot of patients ask, what should I bring to the hospital? Most importantly, you want to make sure that you coordinate with your care coach so that they know when to drop you off at the hospital and when to pick you up. You also want to make sure that you bring a legal photo ID and insurance card. A legal photo ID is a driver's license, state identification card, or passport. Please bring an up-to-date medication list, and please wear sneakers and comfortable, loose-fitting clothes. If you have or use a walker, you are encouraged to bring that with you to the hospital. If not, one will be supplied to you upon your discharge. Please do not bring any jewelry, piercings, or valuables. Please ensure that all makeup and nail polish is removed prior to your surgery. On this slide is the address to the hospital where your surgery will be performed. The address is Montefiore Wakefield Hospital at 600 East 233rd Street, Bronx, New York. On the morning of your surgery, you will be met by a hospital attendant who will direct you up to the second floor surgical suite. When you get to the second floor surgical suite, you will register and be taken into the preoperative area. There you will see your surgeon, you will meet members of our anesthesia team, and you will meet many of our nurses. Spinal or regional anesthesia is most often used for patients having hip or knee replacement surgery. Regional anesthesia works by introducing an anesthetic through a catheter in your back that numbs your lower extremities. Through your IV, you will get a sedating medication and you will go to sleep. Regional anesthesia is preferred because you wake up from the effects quicker, and that translates to moving your new hip or knee faster for optimal recovery. If you cannot receive regional anesthesia, you will have general anesthesia. Which type of anesthesia you will get is determined by your medical and surgical history. On the morning of your surgery, you will also receive preoperative pain medication as well as use the cleansing wipes again. When ready, you will be taken into the operating room. Joint replacement surgery typically takes approximately 1 to 2 hours. Following your surgery, you will go to the PACU, or the post-anesthesia care unit, where you will be for a few more hours. If you are going home on the same day as your surgery, you will be discharged from the PACU with comprehensive instructions. If you are going to stay with us one day after surgery, you will go up to our joint replacement floor. If you are discharged on the same day as your surgery, you may receive a phone call from one of our pain management specialists the following day to make sure that your pain is well controlled. For our patients that are undergoing hip replacement surgery, you may wake up with a special pillow between your legs. This pillow is called an abduction pillow. It is worn for a few weeks after your surgery while you sleep to ensure that your hip does not dislocate. Upon your discharge, you will receive clear and comprehensive instructions on how to care for yourself at home, how to care for your incision, and instructions for showering. You will also be supplied with medication and equipment that you may need. Most patients have a 2-week follow-up via telemedicine or an in-office visit following surgery. It is important to attend those visits. We want to make sure that your range of motion is improving and that your pain is decreasing. Let's talk about some ways to prepare our home for a safe return following surgery. Please make sure that every room is well lit. Make sure that all furniture is spread wide enough apart so that you can get through easily with a cane or walker. Make sure that throw rugs, extension cords, or any other tripping hazards are put away or secured. We want to make sure that a cane, walker, or your feet do not get caught on clutter and cause you to fall. For our patients who have a dog, cat, or any other pet, please make sure that our care coach or loved ones are watching after them just until we are comfortable enough to care for them again after our surgery. Here are some other things to know. Your hip or knee replacement is non-magnetic, so you can have an MRI if needed and it is safe to do so. Throughout the first year after your hip or knee replacement surgery, you will have several appointments with the orthopedic surgeon. It is important to attend those appointments, whether they are in office or via telemedicine. We want to make sure that you are achieving the goals that you set out to prior to your surgery. Patients can typically return to driving 4 weeks after surgery. You and your surgical team will discuss returning to normal activities at your post-op visits. As with any surgery, there are risks involved. Your surgical team will discuss the risks involved with hip or knee replacement surgery in detail. There is a section in your guidebook about the risks of surgery as well. One of the risks of surgery is an infection. All patients who undergo hip or knee replacement surgery will need to take antibiotics orally 1 hour prior to certain procedures for 2 years following your surgery. For a full list of these procedures, please reference your preoperative education booklet. The formation of blood clots is another risk of surgery. All hip or knee replacement patients go home with a short course of an anticoagulant or blood thinner. It's in the form of either an aspirin to be taken daily or an injectable medication. Which type of anticoagulant you get after surgery is determined by your medical history and surgical history. After your joint replacement surgery, your surgical team will contact you to see how you are doing. Please call your surgical team at any time of the day or night for a fever over 101 degrees, drainage around the surgical site, or increased swelling or redness around the surgical site. Pain, swelling, heat, or tenderness in either calf can be a sign of a blood clot. If you are experiencing any of these signs or symptoms following surgery, please contact your orthopedic surgeon's office. A pulmonary embolism is a blood clot in the lung and can be life-threatening. If you are experiencing any signs of a blood clot in your lung, please call 911 and get to the nearest emergency room. Signs of a pulmonary embolism include difficulty breathing, shortness of breath, sudden onset of chest pain, or delirium and confusion.
Hello, my name is Anna DeMilt and I'm a registered dietitian for the Joint Replacement Program. Today I'm going to speak with you about the benefits of proper nutrition. Your body recovers faster when it gets all the nutrients it needs for optimal healing. You can help your body by making sure to eat a balanced diet of nutrient-rich foods. Here are some examples. Protein. It is the building block your body needs the most right now to heal. Make sure to have protein at every meal. Good protein sources include eggs, Greek yogurt, beans, chickpeas, nuts, tofu, fish, chicken, turkey, or lean cuts of red meat. Strong bones need calcium, which can be found in leafy greens such as kale, spinach, Swiss chard, and mustard greens, as well as yogurt, milk, cheese, canned sardines, the low-sodium kind, and beans. Vitamin C helps the body form bone and connective tissue. Foods such as bell peppers, oranges, tangerines, strawberries, broccoli, guavas, papayas, and tomatoes are a good source of vitamin C. After your surgery, you might find yourself not having a big appetite. Small, frequent meals are a good solution. The pain medication given to you after your surgery may cause your system to slow down and make it difficult to go to the bathroom. Unless you're on a fluid restriction, make sure to drink plenty of water and eat fiber-rich foods found in vegetables and fruit, such as beans, avocados, broccoli, chickpeas, pears, raspberries, blackberries, and whole grains like brown rice and quinoa. These fiber-rich foods also provide plenty of minerals and vitamins we need to stay healthy and heal well. A few more things to consider. Sugar-rich drinks such as juices, sodas, sports drinks, smoothies, lattes, energy drinks, and sweetened iced teas can increase body weight, blood sugar, cause inflammation, and may make it more difficult to heal. Water, flavored seltzers, zero-calorie drinks, and unsweetened teas are your best choices to stay hydrated. Plan ahead. Try to prepare meals and place them in the freezer before going to the hospital so you have healthy meals waiting for you when you get back home. A good example of a nutrient-dense, balanced meal is shown on this MyPlace chart. The goal is to fill half of your plate with non-starchy vegetables such as broccolis, cucumbers, leafy greens, carrots, or peppers. Fill 1/4 of your plate with lean proteins such as chicken, lean pork, fish, or tofu. Fill the last quarter of your plate with complex carbohydrates from whole grains such as brown rice, quinoa, whole grain pasta, sweet potatoes, chickpeas, and beans. You may add 1/3 of a cup of fruit to your plate. Good examples are blackberries, blueberries, watermelon, or peaches. A dietitian will be available to you at the hospital during your stay to answer any nutrition-related questions or concerns. A dietitian will also be available to see you before surgery or after surgery. Just let your clinical team know that you would like to be referred to nutrition. Thank you. Eat healthy and stay healthy.
Hello everyone. My name is Joy Norgard. I am the Associate Director of OT and PT. I will be talking about your physical therapy program. Beginning on the same day as your knee or hip surgery, you will be seen by physical therapy. He or she will assist you out of bed and teach you how to safely walk and manage the walker on level surfaces. You will be scheduled for more PT sessions to increase your distance, negotiate stairs, and improve your range of motion, strength, and independence. Your care coach or family member can join a session for training purposes and to see how you are progressing. You may also receive occupational therapy while you are in the hospital. The therapist will ensure your safety and independence in everyday tasks such as using the bathroom and getting dressed. You will practice getting on and off the toilet, standing at the sink to brush your teeth and wash your face, and being able to dress yourself. Your therapist will provide recommendations for any assistive devices that you may need. You will be using 2 pieces of equipment to walk with after your surgery, a walker and a cane. Initially, you will be trained to use the rolling walker. You will use this for a week or 2. You will then be advanced to a straight cane by the physical therapist. Insurance plans will only pay for 1 device, so your surgical team will be assisting you in obtaining them both, either through your insurance and/or your pharmacy. You should begin exercising before your surgery. A good portion of the outcome of your surgery will depend on the effort you put into exercising. All of the exercises can be found in your guidebook, Your Journey Through Total Joint Replacement. Here are some of the exercises. The first is called ankle pumps. Whether you are lying in bed or sitting in a chair, you can do this exercise. It's as if you are pressing on a pedal, pointing your toes down and then pulling them up. This will help in preventing blood clots in your legs, as well as work your muscles. The next exercise is called a quad set. Quad sets don't look like much movement is going on, but you are indeed working out an important muscle. From lying on your bed, you will squeeze your thigh muscle as if you are pushing the back of your knee into the bed. Hold that position for a few seconds and repeat as stated. Straight leg raise. Starting with your legs straight on the bed, bend one knee while keeping your operated leg straight. You will lift your straight leg so that you raise your heel off of the mattress by a few inches. Only the hip is moving. Your knee remains straight. Heel slides. From a lying down position, you slide your heel up towards your buttocks. You will be bending your ankle, knee, and hip more the further you move your foot. And the last 2 exercises are very important for knee replacement patients. From sitting in a chair, you will slide your foot back so that you are bending the knee more and more as your foot moves further under the chair. After that, the focus is on straightening the knee. Slowly straighten the leg out in front of you so that the knee is totally extended. That is a quick preview of your therapy program. Your therapist will add to your exercises and provide you with a copy of what you should be doing after you return home. When you return home, if your insurance covers the services, you will have a physical therapist come to your home following the discharge from the hospital. You will be offered a choice of several home care agencies. We work very closely with Montefiore Home Care Services. Your social worker will help plan an at-home physical therapist if your insurance covers this. The physical therapist will do an exercise program with you and make sure that you are doing exercises at home during the day as well. The average at-home physical therapy program is about 2 to 3 weeks. Ice around your surgical site is a very good source for pain control. Try to keep an ice pack in your freezer for when you return home. Make sure that the ice pack is placed in a cloth and placed on either side of the incision. Never place the ice directly on the skin or over the incision. At some point, you will switch to outpatient physical therapy, but make sure you continue to exercise as much as you can.
Thank you for watching the video. We hope you are more prepared for your joint replacement. Please make sure that you refer to the education guidebook and speak with your surgical team about any questions that you may have.